I'm Nima Rajan, and this is Forum Daily Week in Review. A new study suggests Canada outperformed peer countries during the first 2 years of the COVID-19 pandemic. And this is thanks to our public health measures and a successful vaccine campaign. The research was published in the Canadian Medical Association Journal on Monday. Researchers compared data from 11 countries. The study's co-author says Canada had the highest vaccination rate, the lowest infection rate, and the lowest death rate. Well, joining us now to talk more on this is Dr. Arthur Slutsky, scientist at St. Michael's Hospital and senior author of this study. Dr. Slutsky, welcome to Forum Daily.
Thanks very much for having me, Nima.
So let's start with the main findings from the study and how it was conducted, Doctor.
Well, there's a couple of main findings. The first one is one you've already said, and that's that Canada did very well in terms of overall infections, mortality rate from COVID, and something called excess death rates. So that's the first finding. The second finding is related to the potential mechanisms by which this could occur. And we found that if you looked at the restrictive measures that were had in Canada, they were somewhat greater than other countries, and that Canadians likely, although this didn't come from the data, likely applied the restrictions more than some other countries. But importantly, in terms of vaccination rate, we started a little bit late compared to the United States, for example, but by Canada Day last year, July 1st, 2021, we exceeded the vaccination rate on a per capita basis compared to the United States. We think that that had an impact. And the third thing is the price we paid for all this. There is a price to pay, and then from an economic perspective, we have inflation like much of the rest of the world. We're sort of the middle there. In terms of unemployment, we have unemployment. So we paid a price, and that price is basically to save lives and help the healthcare system.
Well, it sounds like the overall results were positive compared to these other countries. So we mentioned 11 countries were compared in the study. What were these countries? And did Canada outperform all 11 countries?
Yeah, so it was the G10 countries. I won't list all of them, but the United States, the United Kingdom, France, Belgium, Italy, Japan. So out of those 11 countries, Canada did very well. In terms of mortality, we didn't win compared to all the countries, but we did much better than all countries except for Japan. Japan did much better than us. When we looked at the number of deaths, for example, our deaths were about a third of those per capita of the United States. The next highest country actually had about 30% higher mortality compared to Canada. So we did very well. We were not the best in that regard, but we were in the top two in the G10 countries.
And staying on the topic of mortalities during the COVID-19 pandemic, how did Canada, or rather, if Canada were to follow the trajectory of other countries like the United States in terms of deaths, how many deaths could have Canada had due to COVID-19?
Well, if we had the same mortality rate as the United States, we would have had something like another 60 to 70,000 deaths in Canada till the end of February of this year. I mean, that's a huge number, right? So, when we think about the price we paid, there was a price, but there are a lot of people alive today that wouldn't have been alive if we hadn't taken those steps that we took.
And a huge number indeed. Now, bringing this back to Canadian viewers, how did the response among everyday Canadian citizens during the pandemic compare to those in other peer countries?
Well, we don't have exact data on that. We have restrictions that the government sort of imposed on Canadians and the rest of the other countries. And so we don't have data that said how well did people stick to those restrictions. From my understanding on other data, we did very well compared to the United States. For example, Canadians in general were stuck most closely to the restrictions, much closer than a number of other countries. And that, I think, is important because that had, I think, a major impact early on in the pandemic when there weren't vaccines. So this was a critical factor in keeping our people alive, and mainly the elderly and those disadvantaged. That's where the mortality was the greatest. So it had a very big impact totally.
All right, Dr. Slutsky, a quick 45 seconds left here, but where is Canada at now in terms of COVID-19 and the pandemic overall?
Well, I think we're in reasonable shape right now. But to be honest, there's a concern. Going forward, if we stay like we are now, I think we'll be fine. But we don't know what's going to happen in the future. We don't know if there's going to be another variant similar to Omicron that might be more deadly coming down at us in the future. So we have to be prepared. I think that the reason this paper was important was it said to Canadians, look, if you follow the restrictions, et cetera, yeah, it hurts, but it has a big impact. And it's possible that in the fall or later on, the government's going to say, based on science, that we have to take some more restrictions. We might have to wear masks more. And quite frankly, that if that's the case, hopefully will save lives.
Last Friday's Supreme Court decision to overturn Roe v. Wade continues to face backlash in the form of protests and a wave of litigation across the U.S. Much of Monday's court activity focused on trigger laws, which have been adopted in 13 states and were designed to take effect swiftly after the ruling. Overall, 26 states are certain or at least likely to fully ban abortion. Well, joining us now to talk more about the overall impact of abortion bans is Dr. Liza Fuentes, senior research scientist at the Guttmacher Institute, specializing in the evaluation of abortion restrictions. Dr. Fuentes, welcome to Forum Daily.
Hi, thanks for having me.
Now, your organization points to decades of research, which indicates that abortion bans and restrictions don't actually reduce unintended pregnancies or the overall demand for abortion. So what can these restrictions lead women to do in such situations?
When people are seeking abortion care in highly restrictive places, as many states in the United States are, and now that Roe versus Wade is overturned, even more so, or they have to travel very far to even find a clinic that offers abortion care. And in those cases, we see several outcomes. First, people already struggling to make ends meet have often delayed care because it takes time, sometimes weeks, to gather the money and resources like childcare and transportation to even attend an appointment. And those delays add costs. And even though abortion is extremely safe, added risk, because every further along a pregnancy gets, the more expensive it is, and there are some minor risks that accrue. Second, we also may see some people who are struggling to afford abortion care to forego an abortion altogether, because as they are working to obtain care, they time out and are unable to obtain an abortion at all. This means involuntarily taking on the added risks of pregnancy. Continuing a pregnancy is more dangerous than an abortion, and an abortion is safer, even safer than riding a bike. Finally, some people who cannot afford to travel to a clinic may try to self-manage an abortion, for example, by obtaining medications for abortion without the help of a clinician. And while self-managed abortion with appropriate medications is very safe, now that Roe is overturned, we fear that people who choose to self-manage abortion are at greater risk of being involved with the criminal justice system, or maybe perhaps people who help them, with people living with low incomes, immigrants, and people of color most at risk for that.
And Guttmacher also highlights the impact of forced pregnancies. So can you tell us a little bit more about your research into this?
Sure. Our research is grounded in advancing the ability of everyone to decide whether, when, and how to become pregnant and become a parent. So to that end, we have found that the vast majority, if not all, legal restrictions on abortion in the United States are not grounded in any medical evidence, do not improve safety, and do not ensure high quality care, but rather they impose added costly barriers that can sometimes end up denying people care altogether. And as I said, imposing delays, even if they do obtain care, thereby denying pregnant people and their families the ability to care for themselves, and often the children they have. And it's notable that our research shows that 60% of people seeking abortion care are already parents. And abortion patients note being able to take care of the children they already have as one of the reasons for seeking abortion care.
And a lot's happening down in the United States. We know the midterm elections are upcoming, and lawmakers are discussing supports for vulnerable mothers and children. So staying on that point, what do we know so far about current social programs for such demographics?
Yeah, well, states that have sought to highly restrict abortion and now are looking to ban abortion are the states that often have the worst maternal and child health outcomes, and have the most flimsy and thin social programs to support people with regard to things like paid parental leave and other social programs. And just for a case in point, in the case that was just argued and decided to overturn Roe, Dobbs versus Jackson Women's Health Organization That case was originated in Mississippi that wanted to ban abortion at 15 weeks, and they rank 50 at this in maternal mortality. So they're really the correlation between banning abortion and restricting abortion and social safety networks and maternal and child health is inverse. And so we really don't find evidence that states that are looking to ban and restrict abortion are motivated to support the health and well-being of families and children.
All right, Dr. Fuentes, a quick 45 seconds left here, but there are concerns around unsafe and illegal abortions. You spoke a little bit more about that, or a little bit about that earlier in this interview. Tell us a little bit more about these procedures and how they impact maternal deaths.
Well, I know we only have 45 seconds, but I'll just say that today having Roe overturned is different than before Roe. We have medication abortion. It's incredibly safe. And we know that when people are given the proper instructions, they know how to use it. That's not to say that there will be some people who may try other methods that are less safe. And likely what will happen is that they won't be able to successfully have an abortion. And we may see some people who may end up harmed. But with medication abortion, we hope to mitigate that because self-managed abortion with medications are, in fact, very safe.
The United Nations is holding a conference that it hopes will create new momentum for efforts toward an international agreement on protecting the world's oceans. Senior officials and scientists from more than 120 countries are gathering in Lisbon, Portugal for the 5-day event. It's also drawn activists frustrated by the failure to come up with international rules that might ensure ocean sustainability. Oceans cover some 70% of the Earth's surface and provide food and livelihoods for billions of people. Well, joining us now is Dr. Juan Jose Alava, principal investigator at the Ocean Pollution Research Unit at the University of British Columbia. Dr. Alava, welcome to Forum Daily.
Thank you. Thank you for the invitation.
So let's start with comments today by the UN Secretary General Antonio Guterres. So he said egoism on part of some countries has been holding up efforts and agreements to protect the world's oceans. So what does he mean by egoism?
Well, it really tells us that there is an unsustainable use, there is overuse and misuse of ocean marine resources in some areas of the world. One example is the illegal, unregulated, and unreported fishing activities that is taking place in some oceans and tropical seas around marine protected areas of the world, which are coming from international nations, and they are fishing in international waters. For example, basically harvesting some of the unique resources. Many of them are endemic species. For example, international fishing fleets coming from Asia around the Galapagos Island is one example in which basically we are putting in danger unique marine biodiversity upon which many coastal communities rely on. Another issue is basically the systematic issues at the heart of the societal inequalities and inequities, in which some coastal communities have less access to marine resources than other more wealthy nations. So that's very important because the ocean is where most of the people depend on. And here in Canada, for example, the coastal First Nation community are heavily dependent in what the ocean provides to them. An example is the salmon fishery, the herring fishery that need to be taken care of. So it's very important to think about that if we have healthy ocean, we have healthy water and healthy seafood for people. And the point that the UN Secretary Antonio Guterres says that we have an ocean emergency. It's very important to keep in mind, because by saving our ocean today, we are protecting our future, the future for future generation. And that's the fundamental concept of sustainability, to leave something for future generation, not just something so that they can enjoy the same resources, marine resources that we are enjoying today. And that's a fundamental thing, because there is only one planet, Earth, and there is one big blue planet, and that is our global ocean, right? And in addition to that, we know that the pollution is a huge issue. So ocean plastics pollution is basically affecting many parts. There is not really ocean that is plastic free. So there are this emission coming from many parts of the world, and the irony is that most of the plastic debris, the marine debris, the anthropogenic marine debris, I mean human-made debris, is affecting nations that are not really producing that debris. So this is a problem that needs to be addressed with actions today, with the political will of all the nations to really protect also the most isolated Pacific Island nations, for example, coastal communities, indigenous people that heavily rely on marine resources for subsistence, basically. So that's very important to keep in mind when we are talking about today, according to the recommendation that the UN Secretary just recommended, that we really need to think about in a blue economy and kind of innovate for sustainable oceans. That means that we really need to think about from the point of view of promoting a socially equitable consumption of resources that need to be economically viable and also environmental sustainable. So that's very important so that coastal community minorities and marginalized groups can enjoy also the resources in a fair way. And I think the concept of social equities is a new concept that is coming, it's emerging today. We are talking about today social equity and environmental justice in the ocean. And that's important because there are a lot of societal inequalities and because of the lack of equal access to marine resources and the service and ecological function of the ocean. So it's very important that we make sure that coastal nations in the world, everyone have equal access to healthy water, healthy ocean, healthy seafood. So,
Dr. Alavra,
yeah.
Unfortunately, we are nearing the end of this segment, but a lot of important conversations needed to be had at this 5-day summit. So we'll definitely keep an eye on that. Dr. Alavra, thank you again for joining us today on Forum Daily.
Thank you very much.
We'll be right back. Halifax Regional Council is discussing the idea of a federal guaranteed basic income. Councillor Wei Mason brought forward the issue and wants a letter sent to the Prime Minister and Premier to request the implementation of a basic income to bolster the social safety net. A report released earlier this month found income support would reduce inequality, establish a sense of financial security, and encourage savings. Well, joining us now to give us deeper insight into what a guaranteed federal basic income would look like is Dr. Elizabeth K. Raining-Bird, Chair of Basic Income Nova Scotia and a member of the Steering Committee of Coalition Canada Basic Income. She's joined by Pierre Stevens, a member of Basic Income Nova Scotia and a retired senior instructor at Dalhousie University. Welcome to Forum Daily.
Thank you. Thank you.
So let's start with this motion itself put forward by Mr. Mason. What exactly is he asking for, and what would this program look like in Nova Scotia?
Councillor Mason is requesting that the Mayor write letters to the Prime Minister, to the Premier of Nova Scotia, and to ministers. And the letters would be requesting that the governments implement a basic income throughout Canada.
And what would a realistic federal basic income look like throughout Canada? Who would qualify for it?
The request is being made to provide a regular payment made to people who need it and distributed with minimal bureaucracy. What that would do would be to dramatically reduce poverty in Nova Scotia and throughout Canada, improve the physical and mental health of individuals who are currently living in poverty, and increase people's sense of well-being and actually trust in government.
Now, on the other hand, I want to jump to a recent report by Atlantic Province's Economic Council. It indicates that guaranteed basic income would require higher taxes or cutting government spending, which could involve cuts to social programs. So how can officials implement a basic income program without impacting certain groups?
Advocates throughout Canada, including here in Nova Scotia and the Atlantic provinces, are advocating for a basic income that would not replace the social programs. It would become an important component of a comprehensive social safety net. So the claim by APEC that it would replace social programs is unsubstantiated. And the second aspect of that question, the question about taxes, is an interesting one. higher taxes are not always a bad thing. Our taxation system over the past number of years, past number of decades, has become less and less equitable. And if we were to modify our taxation system to become fairer and for the wealthy and corporations to pay their fair share, then that would generate a tremendous amount of money to support a basic income.
So let's stay on the topic of these higher taxes. What would these taxes look like, and who would these taxes impact the most?
They certainly wouldn't impact people who are poor or people who are middle income. They would impact people who have a lot of money already and can afford to increase their taxes. We don't know exactly what the taxes, any changes in taxes might mean. It's possible that they could take a lot of different forms. UBI Works, for example, has proposed that there's a variety of funding options that could be made. We could increase contributions from the financial sector. We could provide fewer tax breaks for big companies. We could provide fewer subsidies for the wealthiest people in Canada. All of these fairer taxation. I want to emphasize, however, that we really don't know right now how the government would fund basic income. Many programs that are funded with deficit funding. For example, the Canada Child Benefit was funded with deficit funding. And after it was implemented, it actually generated economic gains for the country. So it is quite possible that we don't need to modify the taxation system to create a basic income.
All right, I'm Nima Rajan, and that'll do it for your look at important conversations from this past week. Have a great week in Canada. We'll see you next time.